Pain. Everyone has felt pain. But what is happening when you feel it? And what are the different types of pain? And why? Here is your quick explanation. Put simply, pain is your body telling you that something is wrong. It doesn't feel good, but sometimes we need that. When we do something that harms our body, we need that internal messenger to say, hey, stop, that's hurting you. That helpful pain, or acute pain, is like an alarm system that tells us that a certain part of our body is damaged or inflamed from injury. We know just where that injury is because our body has sensory receptors all over it that sense the damage and send the signal up through pathways in our brain that make us aware of just where that pain is, like a blip on a radar. That way, if we have our hand on a hot iron, we know to move our hand out of the way and not our foot, because our foot is not the part being injured. Since the pain tells us where the injury is, it is for the most part more easily treated. The other kind of pain that many people experience, though, is called persistent or chronic pain. This kind of pain is not protective in the way that acute pain is, because your body is getting the same signaling that tells you that some part of your body has damage or inflammation or injury, just like acute pain would. But the problem is that there is no damage, and oftentimes the pain is not felt so clearly in one spot like acute pain is. This makes it much more difficult to treat. So while we can think about things in the body that might be causing it, there are other things that might be causing this type of pain or affecting it. So what are some things that could affect both chronic and acute types of pain? Why does each person's pain present differently? Well, there are many aspects of pain that should be recognized. The reason that not everyone's pain is the same is because not everyone is the same. Each person perceives pain in their own way and based on past experiences, and mental and emotional states can affect your pain. Pain messages are being sent from all around the body to the brain, and there are millions of connections, so it would be silly to think that other signaling in the brain, such as those related to emotions, would never get involved. A lot of research has shown that pain can become persistent with trauma or depression. And in general, a large amount of stressors, emotional or mental stressors, can make you more sensitive to pain. The pathways in the brain involved in pain are similar to those that help it encode traumatic events. So that overlap can create an overactive system. As if pain isn't already bad enough, having other stressful things going on in your life can exacerbate it. You might start to find things extremely painful that didn't used to be painful at all. So for healthcare providers like myself, we must understand that pain is multifaceted and must be treated holistically. We watch out for our patients and make sure that everything is going okay in their life outside the clinic as well, so that they can heal the best way possible. And patients should hopefully feel comfortable sharing information with me about their stressors, since that could be adding to their pain and might give me some insight into what might aid in their recovery. It might seem like a separate issue, but the fact is that we are all human, and anything that we feel is connected, whether that is in the body or mind.